guys, welcome back to the channel. Peia Alexis here with another video. This video here, I have been getting a lot of questions regarding apheresis. As you guys know, I am an apheresis nurse, have been since 2019. So that's why I decided to start a YouTube channel. It's just to shed light on apheresis. A lot of people don't know what it is. Before I started, I didn't know what it was. And just to kind of give you a look into apheresis if you so choose to make that a career path for yourself. So if you are interested in learning a little bit more about apheresis nursing, stay tuned, guys. Okay, like I said previously, I'll give you a little backstory about me. I have been a nurse since 2012. Prior to that, I was a teacher. I knew kind of right away that that's not what I wanted to do long term. So I went back to school and decided to do the accelerated program to get my bachelor's of nursing. So I've done a little bit of different types of nursing. I've been a skilled facility RN coordinator. I have been a PACU nurse. I have been a psych nurse. And that's where I stopped before I started apheresis nursing. Didn't prefer psych nursing, stayed a little bit longer than I probably needed to. But I just so happened to meet an apheresis nurse there that was doing psych on the side. So she told me all about the position. I was in dire need of a change at that point. Like I said, 4 years of psych nursing is a bit much. If you've ever done psych, you probably know what I mean by that. So I decided to check out apheresis. So first of all, I had to look it up because I was like, apheresis nurse, what is that? So I get a lot of questions like, apheresis, what is apheresis? So basically, apheresis is pulling patients' blood from their body, spinning, separating in a centrifuge, and returning. Very similar to dialysis. Dialysis pull, spin, separate, and filter because the kidneys cannot. We pull, spin, separate, and return, pulling plasma. So plasma is where the antibodies lie that is creating the illness. So we generally, for the most part, tackle autoimmune diseases. Sickle cell, myasthenia gravis, Guillain-Barré, multiple sclerosis, acute mediated rejection of the kidneys, the heart, the lungs. We do a number of disease processes with myasthenia gravis and sickle cell being our two major populations. So that's what apheresis is. It's pulling plasma, pulling blood. We separate, pull out the plasma where the antibodies lie, and return with either fresh frozen plasma, because you have to replace, with albumin or with red blood cells. So that is just the foundation of what apheresis is. And I had no clue. I had zero clue of what apheresis was when I started. Now, like I said, I have been in my particular hospital since 2019. So I have a substantial amount of experience now. Like I could probably do it with my eyes closed at this point. So I do have a little notebook of like questions that I've gotten through email, through YouTube. So I'm just gonna go down the line and just flow. So if at any point in this video you have questions maybe that I didn't address, you can just leave it down in the comments and we can go back and forth that way. So I told you a little bit about apheresis, why I decided to do apheresis. I just needed a new fresh start, a change. Psych nursing is not procedural, is not really hands-on. Typically it's babysitting and I wanted some hands-on. I came from, prior to that, doing PACU, where you get a lot of experience working with A-lines. So I've done leech therapy, like a whole lot of stuff to go into psych. Now, I've always wanted to try psych, so that's why I decided to delve into that. And plus, the money was a little bit better than PACU. So that's why I decided to do apheresis. So I had zero experience. I've never been a dialysis nurse. I have zero experience with apheresis. So you can go into apheresis not ever having experienced it in a hospital. So I told you a little bit about what it is. I told you a little bit about the diagnoses. So multiple diagnoses with sickle cell disease and myasthenia gravis being our two major populations. But we do a number. We do, like I said, acute mediated rejection of the kidneys, the heart, CAS neuropathy that deals with the kidneys, encephalitis, like I said, Guillain-Barré, myasthenia gravis, multiple sclerosis. I mean, hyperviscosity, cancers, like on and on and on. You can do a lot with apheresis. If it's an autoimmune disease. So those are just a number. We have a whole list in our department of diseases that we can do apheresis on. It's graded from A to like D. Was, the top that we can actually, help the patient. So myasthenia gravis, sickle cell is like at the top, with neuropathy maybe being low at the bottom of actual change that we can do with apheresis. So I had no experience. I came on, and it is 9 months of on-the-job training. So you work for 6 months, and then they put you on call, but you're still training. So we cater to a variety of ages. So I've done as small as days old infants to 99, 98-year-old myasthenia gravis patients. So you're constantly learning, but the training period is, the orientation period is 9 months. So like I said, I had no clue. So I came in and I was taught the machine, I was taught the kit, I was taught the different diagnoses. And then you go on into learning the different accesses. So either people are going to come and they're going to have a CVAD, or central venous access device, coming from their chest, or they're going to have ports. Or we can, if you have adequate veins, we can do it peripherally with a steel needle. So you're coming in with no experience, you're learning the machine, you're learning the diagnosis, you're learning the different access capabilities, and this is with zero experience. So it is quite a learning curve. Now, I felt at the beginning very overwhelmed. I had no experience, so you gotta learn this big machine. You gotta try to troubleshoot this machine when it is beeping, or when it gives you alarms, as well as getting to know patients that are coming on a routine basis. So learning a new machine, learning access, and learning new patients who are regulars, who most patients aren't fond of new faces. So I was very overwhelmed at the beginning. It took me, I would say, a good 6 months to feel comfortable, because I could put in an angio before this with my eyes closed, but a steel needle inserted into a vein where they have to stay extended for a certain amount of hours, and you got to put the needle in the vein, and the patient can't move. Like, that was just overwhelming to my brain. But I got used to it. And that took me, for my comfortability, was probably about 6 months, I would say. Um, my patient's comfort, it didn't take long because I feel like I'm personable, a people person, and I was able to get them comfortable with me once they saw that I could access and I could put needles in, and I had no troubles with that. So 9 months on the job training to learn 7 treatments. So apheresis, my particular department, we do 7 treatments. We do plasma exchanges. We do red cell exchanges, taking the red cells out, replacing it with fresh red cells. So taking the sickle cells out from the sickle cell patients, placing with red blood cells. We do lipospore, which is LDL apheresis. So patients that can't process their fat cells, we remove. We don't replace, we remove. So that process is learned in apheresis, but through the actual company of the machine. We do photopheresis, so patients that are experiencing, let's say, stem cell and lung rejection, we do photopheresis with those patients. So we take their cells out, treat it under a UV light, and replace and treat those cells, and it stops the rejection. Okay, and then we also do stem cell transplants. So we remove the patient's, basically we're removing the patient's stem cells from whatever access point they have, generally a CVAD, and this procedure can take about 6 hours. So we retrieve stem cells. We also do white blood cell reductions, so cytoreductions. We do platelet reductions. And all of these platelet reductions, white cell reductions are all emergent. Those two are emergent cases. The others, plasma, red cell can be emergent if they're having acute chest or stroke-like symptoms. The fat cell removal, that's not emergent, but they do it on a weekly basis or bi-weekly basis. So a lot of our patients are routine. Plasma can be once a week or every 2 weeks, depending on your disease process. The lipospore is weekly. The photopheresis is a specific schedule, really particular specific schedule. So I won't go over that because that can be a little confusing. And that's what we learned. So a total of 7 treatments total you're learning in a 9-month span. So I was working maybe a year and a half before I was called in for a white cell depletion. Absolutely no training. Luckily, we have like a little cheat sheet where you can read and know how to program the machine and what to do. So I was called in the middle of the night, no training, with my attending, and I had to read a sheet. Of course, I had coworkers that I could call, and I was able to call and do it appropriately. But some things during the 9 months you just don't see because they're emergent and they just don't happen to people very often. White cell depletion just doesn't happen very often. So, so that's that. That's the training of it all. Like I said, I do have a bachelor's degree in nursing, but it doesn't require you to have a bachelor's degree in nursing. That's just what path that I chose to take. We have lots of nurses that just have their associates and they do just fine. So as far as education go, it's not going to hinder you in what you learn. Okay, so each treatment can be 1 to 2 hours for like a plasma. A red cell can be as quick as 15-20 minutes to an hour depending on quantity. The lipospore is like 1.5 to 3 hours, depending on patient's height and weight, hematocrit. The ECP machine can go as long as probably 1.5 hours total. Stem cells, depending on the patient and the severity of their illness, can be up to 6 hours of retrieving stem cells. Our stem cell patients generally have multiple myeloma or lymphoma. We do a lot of commercial stem cell retrieval as well. That would just make this video so long, but just know we do stem cell retrievals. We do whole blood retrievals as well. So I don't want to go deep into that unless you guys want me to do another video. I'm just kind of giving you the basis of apheresis. So, like I said before, it's very similar to dialysis. So if you've ever been to a dialysis nurse, then it's very similar. Dialysis, generally the clientele have fistulas, and we do that as an access point that we do use as well. So you're learning with the CVADs, with the ports. We have power flow ports, we have porticavs, we have just using the arms peripherally, and then fistula. So if I'm being honest, fistulas made me freaking nervous. I think because my preceptor just made me very nervous about using them and how you can bleed out and so on and so forth. So I just been very cautious and very like hands off. This year I have vowed to just tackle it and just, you know what, Peia, you got to learn, you got to do. So I feel very accomplished this year because I feel comfortable doing them. So you don't have to be a dialysis nurse to be an apheresis nurse. It is helpful, but they don't coincide. Okay, so typically a daily schedule depending on your shift. So we do 8s and 10s, so 5 8s, and then I chose to do 4 10s because I like my day off. And I was doing 5 8s, and it was very draining. I didn't have time personally. I didn't have a lot of time, you know, make appointments for my children, so on and so forth. So I chose to do 4 10s. So it works out where I can do my off day is Monday. So I always have a 3-day weekend. So that worked perfect for me. Not necessarily saying that is what's going to happen if you choose apheresis. That's just how my job is set up. So typically I have 2 to 3 patients a day. If you're scheduled to do a stem cell patient, then you have 1 to 2. If you're an 8-hour shift person, you have that 1 stem cell because it can last 6 hours. But if you're doing plasma exchange, red cell exchanges, you can do 2 to 3 patients a day. Easy. In my 10-hour period, I can do up to 4 patients a day. Like if I'm on call and I know it's something in the back end that I don't want to be called in for, and the patient is available and the line is ready or their access is ready, I go ahead and do it before I leave. But you can do 2 to 3 patients a day. Very easy. Like I said, most procedures are less than 1 to 2 hours. So 2, 4, that's have your lunch in between. For me, that's really easy. 3 is easy. Is it tiring? Can it be overwhelming? Yes. We are very busy in my department. I will not lie. When I first got there, it kind of ebbed and flowed. Like there were times where I could do 1 patient a day and just kind of sit there and do education for the rest of the day. But now I don't know what's going on with today's. I don't know what's going on, but we are busy. We are busy. We just had last week lots of patients with the same disorder come in, and that's very unlikely. in the same week. So 4 patients with the same disorder in the same week is very, very uncommon. So we were very overwhelmed with the amount of inpatients in the hospital. I don't know if I stated before, but most of our patients are outpatients. So they come in weekly, bi-weekly, whenever we schedule their appointment, and whatever the doctor orders is when they come in. But we do go throughout the hospital, anywhere in the hospital, and do patients all the time. So how our schedule is set up, we'd have an 8 o'clock patient and an 11 o'clock patient. And then me personally, I have a 2 o'clock patient because I'm a 10-hour shift person. So it's set up to where you do your first 2, you have a break, for me in particular, and then I can do my last patient, and I can be done by 3:30 for the latest. So it's not bad. Like I said, just depends. It could be very overwhelming, if I'm being honest. So in my particular department, we do have on-call services. So apheresis, trauma can happen anytime. So we have somebody that's on call every day. Each person is generally on call 4 to 6 times a month. So you are on call a weekend, and then the rest of your days. So you're on call that Friday, Saturday, Sunday, and then the rest of your days are kind of scattered throughout the month. And you do get called in occasionally. 2 weekends ago, I worked Saturday and Sunday, had 2 patients each day. Is that common? No. But it happens. And that's when you start rethinking your life. Is this what I want to do with my life? I don't know. But it does not happen often. But I want to give you guys the real. We do have a nurse that is traveling, and she said how we're set up is very different than how they're set up. They don't do a lot of red cells. They do a lot of stem cells. They just don't work as hard as we do. So I cannot say that apheresis where you are is going to be the same as where I am. Where I am, we just have a lot of red cells. We have a lot of myasthenia gravis patients. We have a lot of commercial stem cell retrievals. We just have a lot. And my attendings tend to be a little bit more lenient on space. Oh yeah, we can do it. Oh yeah, we can do it. Oh yeah, we can do it. We also do research. So we do research as well. And that tends to be that heavies the load. It does heavy the load. So that is apheresis really in a nutshell. I'm sure that I'm probably missing some items that you guys are wanting to know, but I think I went over just about everything. Education, scheduling, on call, additional education, which you don't need. You need BLS, of course, but you aren't specifically trained on anything else. Like you don't need ACLS. You don't need any of that, because if we're calling a code, the hospital comes. We do like code medic or code. We don't have code blue because we're considered a clinic inside of a hospital. So basically, I think I answered all of my questions. On the job training, no additional training. For each particular machine. So we use Optias. I don't think I went over this. We use Optia plasma exchange machines. But for the lipospore, the LDL apheresis, they have their own machine. And for the photopheresis, they have their own machine. So the outside person that specializes in that particular machine, they come in and train you. And this is after your 9 months. So you got to get the 9 months of plasma exchange, stem cell, on pediatrics as well as adults. under your belt before you can be trained specifically on LDL, apheresis, and photopheresis. So in my particular department, besides the travel nurse, I'm the only one who knows every single machine. And sometimes that can be overwhelming because it's like, oh, I don't know that machine, so you have to do it. That's a departmental issue. That's not an apheresis issue. So do I love what I do? I absolutely do. I feel like with nursing, sometimes you don't see the immediate change of a patient for the better. It's just like a kind of a, you really just seeing it for that short period of time that you have them before they go to the floor. Skilled facility, you don't really see much of a change. And then psych, they're there for a certain amount of days. You don't see them anymore. Here, because we have recurring patients that are routine, I get to see, oh, you're feeling better today, or oh, you don't feel so well, so maybe by the end of this treatment you'll be feeling better. So that's what I love about what I do. As far as all the nursing departments that I've worked in, I enjoy this the most because the attendings are just right there all the time. You have any questions, they answer them. And then a lot of the enjoyment of any job is your team, your teammates. So I enjoy what I do. As for right now, I do. Will that change in another month? Will that change in another year, a few years? Maybe, quite possibly. Nursing is ever evolving, and you're always able to choose different things. That's the joy of being a nurse. You can be apheresis nurse one day and a dialysis nurse the next day. You can be an apheresis nurse one day and an oncology nurse the next day. So, and the way that healthcare is going and the way that nursing is going, there's always openings. But as far as right now in this particular moment, apheresis nurse is where I'm gonna stay. So I think I went over everything. We treat children to adults. There's really not too much age specification. On red cells, yeah, we like to have them. I think the youngest we've treated is like 7. And we have recurring pediatric adults in that area as well. So I think I told you a little bit about everything. If you guys have any questions, like I said, maybe something that I didn't answer that you're curious about, let me know. That's why I made this channel, is just to give a little bit of insight on apheresis nursing and all things beauty and fashion as well, because that's what I love. So hit me up if you guys through my email, it's peiaalexis@yahoo, or you can just send me a comment through YouTube. Make sure you subscribe. I haven't been doing too many apheresis videos. Like I said, guys, we have been crazy busy, overwhelmed, like it's no downtime. I'm hoping we're on that down slope of all the cases that we have. So if I did not answer something that you're curious about, send me a message. I appreciate you guys stopping in. Hopefully this gave you some insight on apheresis nursing and just apheresis in general. And I should see you guys in